The comprehensive in-home geriatric evaluation is a service that helps a lot of seniors. Most of the time I'm hired by their sons or their daughters or by their spouses. Questions that I'm typically asked to deal with have to do with cognitive dysfunction or dementia, problems with taking too many medications, or feeling that they're seeing too many physicians but nobody's connecting the dots and treating the patient as a whole. And I try to come in and do a very broad and very deep evaluation of the older adult. This includes obviously a thorough review of their medical problems and each of their medications, a very careful review of their nutrition, how they're eating, who does the cooking, who does the shopping. And because I'm acting in the home, I get a good look at their living environment and can make a very nice assessment of their functional ability and what their current and anticipated future needs might be. The evaluation process starts by you sending me the last 2 years of your medical records, which we can obtain from your primary care physician. I'll carefully review those records and then contact you to make an appointment to come into the home at a time that's convenient for everybody. In the home, the evaluation takes about 2 to 4 hours, and it's really quite thorough, and it involves a good interview process. If I'm doing my job right, you're doing most of the talking. It's really an interview, and I'll ask you to tell me about yourself, and this is the best way that I can assess your cognitive performance. There'll be an examination done, as you would expect for a medical process, and if I feel there's any x-rays or lab tests that need to be done, we'll get those done as an outpatient. I work on one case at a time, so for the next week to 10 days, I'm focused only on your issues. As I review my notes, put together my findings, do research, and write up a formal report. I'll send that report to your primary care physician, and then we'll make arrangements for me to come to your home a second time. I'll present to you the report and talk with you and your family in plain, easy-to-understand language so that you understand my medical findings and my specific recommendations.